Why is your doctor getting your chronic back pain wrong? Researchers recently looked at a conglomeration of studies. They looked at 56 different treatments for acute and chronic low back pain, and they found that basically not much works, but there are a few things. One of the reasons that back pain and chronic back pain is getting so much worse in the United States is that care is not individualized, because people are being seen like one of 6 patients at a time in a clinic owned by a physician, particularly in the orthopedic surgery realm. And what this research study showed was that one of the best treatments for back pain, which was actually proven in several studies that were published back in 2005 and 2006 in the journal Spine, written by and research done by Dr. Timothy Flynn at Baylor University, is that joint manipulation to the spine is one of the #1 treatments for both acute and chronic low back pain. I'm going to say that again. Manipulation of the spine is the primary #1 treatment for both acute and chronic low back pain. So if you have back pain or neck pain and you're going to a clinic where you are one of 6 patients being seen by a physical therapist, but you saw the physical therapist on visit 1 and since then you've been doing exercises with the physical therapy assistant who's not allowed to do joint manipulation, they are not providing you the best care. End of story. The second runner-up was joint manipulation with exercises specific to the patient that helped improve mobility and increase strength but did not create pain. In most clinics, there is a here's your low back pain protocol given when they're seeing so many patients at one time. It's not individualized at all. The third thing that was shown to improve low back pain was actually hip mobility and strengthening exercises, particularly in a rotation movement. So if you're someone who's been suffering with chronic low back pain, chronic neck pain, and no one has actually manipulated your spine, it's probably time to find somebody else. If you're doing exercises that increase your pain while doing them or directly after, it's probably time to find somebody else. And if you are not doing hip strengthening in rotation, so seated, and just like the shoulder rotates, internal and external rotation, if you're not doing exercises that would look like that for your hip, clamshells aren't it, y'all. It's time to find somebody else.